What is PrEP and how does it prevent HIV? A nurse practitioner explains how medications to prevent HIV work and when people should consider taking them. An estimated 1.2 million Americans are living with HIV, a virus that attacks the body's immune system, and while new infections have declined significantly since the peak of the HIV epidemic, 31,800 people were newly diagnosed in 2022, according to the most recent data from the Centers for Disease Control and Prevention, CDC. There is currently no vaccine available for HIV, however over the past decade, the breakthrough medication PrEP, pre-exposure prophylaxis, has driven down the rates of transmission. PrEP prevents the virus from taking hold and spreading throughout the body, and when taken correctly, reduces the risk of getting HIV from sex by 99%. It does not protect against other sexually transmitted infections, STIs, like syphilis and gonorrhea, so it's advised with condom use and frequent HIV and STI testing. Since PrEP became available in 2012, we have seen a significant reduction in new HIV diagnoses in New York City and the world, says Caroline Carnevale, a nurse practitioner at New York Presbyterian/Columbia University Irving Medical Center. It has also provided many people with relief from worrying about HIV transmission in their sex lives. PrEP uptake has increased steadily since it was approved by the Food and Drug Administration, FDA. But more progress is needed, says Carnevale. The CDC estimates that about 300,800 people were prescribed PrEP in 2020, representing only 25% of those who could benefit from the medication. Racial disparities also persist. 13% of Black and 24% of Latino people who could benefit from PrEP were prescribed it in 2022, compared to 94% of white people. Scientists are hopeful that a new form of PrEP, now in the final stages of FDA approval, will be a game changer. The medication, called lenacapavir, is a biannual injection that has been remarkably effective. A recent clinical trial conducted across 88 sites in 7 countries found that the medication provides near 100% protection from HIV. Carnevale shares what to know about PrEP. PrEP comes in 3 forms. There are 3 different options for taking PrEP that are approved by the FDA: a daily pill, long-acting injectable, or on-demand. PrEP works by blocking the HIV virus from attaching to cells, preventing the virus from replicating and causing an infection. The 2 pills approved for PrEP are called Truvada, intractable tenofovir, and Descovy, intractable tenofovir alafenamide. The long-acting injectable form, Apretude, cabotegravir, was approved in 2021 as a single intramuscular shot given every 2 months. The injectable form of PrEP is equally as protective against HIV as the daily pill, if not more so, because you don't have to worry about taking a pill regularly, says Carnevale. On-demand PrEP is for people who want to plan for protection around a sexual encounter. It is taken in a series before and after sex, 2 pills between 2 to 24 hours before sex, 1 pill the day after, and another pill the day after that, 2-1-1. Unlike the other forms of PrEP, on-demand PrEP is only approved to be used when taking Truvada and, in the US, it is only approved for use for men who have sex with men. PrEP is safe for everyone, including pregnant people. There are no qualifications for starting PrEP, says Carnevale. It is for anybody who wants it and is sexually active and does not have HIV. PrEP is safe to use during and after pregnancy. And for people with an HIV-positive partner who has an undetectable and untransmittable viral load, PrEP adds a layer of protection. A healthcare provider must prescribe PrEP and will schedule health screenings with HIV and STI testing regularly, depending on the prescription. For the PrEP daily pill it's every 3 months, and for the long-acting injectable form of PrEP, it's every 2 months. Some people taking PrEP may have minimal side effects, like nausea or headaches, but they are usually not serious and often get better over time. Adverse effects like that are very rare, says Carnevale. It is really safe and effective. What is PEP, and how is it different from PrEP? Another medication to prevent HIV transmission is called PEP, post-exposure prophylaxis. It also works by blocking the virus from replicating. However, PEP is for emergency situations only. PEP should be started within 3 days, 72 hours, of potential exposure, but the sooner you start, the better, says Carnevale. It comes in the form of a daily pill taken over the course of 4 weeks. Like PrEP, PEP is approved by the FDA for anyone 12 years of age and older, is safe to use during pregnancy and breastfeeding, and a prescription is required from a healthcare provider, urgent care, or an emergency room. The side effects for PEP are also minor: nausea, upset stomach, fatigue, and headaches, and should go away after the first week. After finishing PEP, a provider will schedule another HIV screening 4 to 6 weeks after the exposure and again 3 months later. Additional resources: New York Presbyterian launched the Sexual Health Mobile Medical Unit, which brings comprehensive sexual health services to underserved communities.